Hello everyone, welcome to my channel Ravi Study for You. So in the series of pharmacological subject, we will take another topic which is autonomic nervous system. So in this topic, we are studying what kind of action happening in our body and also what kind of medicine we are taking during the different kind of situations. So we are moving further. So what is autonomic nervous system? So autonomic nervous system regulates involuntary body function through sympathetic fight and flight and parasympathetic rest and digest branches utilizing neurotransmitter, acetylcholine, and norepinephrine, and androgenic and cholinergic receptors. So basically, that kind of things we are studying here. So general consideration first, which is sympathetic nervous system. So sympathetic nervous system is processed by our um, autonomic nervous system. So in this system, we are like for a fight and flight kind of symptoms will be occur. So in this symptoms, what will be happen in our body? The pupil will be dilate, heart rate will be increase, and the dilation of the bronchioles, GI motility, it means the gastrointestinal motility will be increased, and the vasoconstriction will be occur, and also the vasodilation will be occur during different situation in our body. So the prepares body for stress, people for fight and flight, increasing heart rate, people dilation during different kind of situation. So that is the sympathetic nervous system. So that kind of things will be occur here is the brain, pons, medulla oblongata, cerebellum, and there is a spinal cord. That kind of function will be occur in sympathetic and parasympathetic nervous system. Next is to be parasympathetic nervous system. So conserve energy, regulates digestion, rest and digest, uses ache and both pre and post ganglion neurotransmission. It means all the involuntary control of the body, which will be digest, rest, decrease heart rate, constriction of the pupils, and increase gastrointestinal motility. That kind of things will be occur in parasympathetic nervous system. It promote urination and neurotransmitter acetylcholine and originate from carcinocaral place over inside in our the body. So there is some receptors which is present in our body for their stimulated the androgenic and non like cholinergic and non-cholinergic mesoneric epinephrine symptoms in our body. So there is alpha 1, alpha 2, beta 1, beta 2, and beta 3. Make sure beta 1, beta 2, beta 1 basically it is present in our heart for their contractility. So the cholinergic, mesonergic, M1 to M3 is a nicotinic receptor so in our body and also they stimulate the acetylcholine in our body. So there is some receptors and there is what is their action will we are studying here. So there is alpha 1. So what is their action? It will be happening in our body. So vasoconstriction, there is the blood vessel will be constriction and the flow of the blood will be increased. Next is to be alpha 2. What will be do? It will be decrease sympathetic outflow. It means the fear and flight will be decreased if alpha 2 is like receptor we have binding some acetylcholine of the stimulator. What is the receptors? Beta 1 is will be to increase heart rate and their increased contractility. It means during fear and fight movement there is some take one example. If dog is are behind me and there is running behind me, so there is heart rate it will be increased. So there is beta 1 activated on the time and there is increase the heart contractility over the time. Next is to be beta 2. There is a function is bronchodilation. It means the capacity of oxygen in our lung will be increased over the time during the beta 2 receptor will be presence. Next is to be beta 3. So what will be action? It will be so the lipolysis, urination, bladder relaxation. All of these action will be show if beta 3 is activated over the time. Next is to be somatic nervous system. What is the meaning of somatic nervous system? It is a component of peripheral nervous system that enables voluntary control and skeletal muscle movement and process conscious sensory information, touch, pain, temperature, and proprioception. So basically, the touch, pain, and the temperature it will be present in our sensory fiber or motor muscle. It will send the signal into the brain, and afferent fiber come into the efferent fiber will become to the signals into the muscle or sensory fibers for the signal for contraction or like heat and temperature feeling over the skin during the situation. It consists of afferent sensory and efferent motor neurons utilizing of neurotransmitter acetylcholine and trigger muscle contraction. What is the meaning of neurotransmitter? For the transmission of impulse across the synapse, neurohumoral transmitter substance is released into the synaptic cleft. It is autonomic nervous system and neurotransmitter released are acetylcholine, non-adrenaline, and dopamine. It means neurotransmitter is that kind of activator. It will be bind to that hormones or there is different kind of autonomics or peripheral nervous system to activate their action during the different situation. So that is the introduction. And next part is to be cholinergic system. So what is the meaning of cholinergic system? Acetylcholine and ester of choline is an important neurotransmitter of autonomic nervous system. The nerves that synthesize, store, and release acetylcholine are called cholinergic acetylcholine. It released in response to cholinergic stimulation. It means cholinergic system is symptomimic. It mimics the symptoms of acetylcholine, is an important neurotransmitter of autonomic system. It means it is like mimicking the action of acetylcholine, and it will be send the signal for working different kind of function in our body. So the nerves that synthesize, store, and release acetylcholine are cholinergic. It is a symptomimic. So what is their action? It will take one example. There is a nerve. So what is their action? It will be sending the signal towards the another neuron. So the same cholinergic system, that will be same kind of action will be shown in that thing. So next is to be acetylcholine is released in response to cholinergic stimulation. It means the acetylcholine release whenever the cholinergic system will be in response or occurring over that time, it will be essential on that time. The site, which site the cholinergic system will be activated, like ganglia, all the preganglionic fibers of autonomic system at both the sympathetic and parasympathetic ganglia. Both the symptoms, it means there is sympathetic, it is fear and fight movement, there is cholinergic system, it will be present and activate their action, the dilation pupil or vasoconstriction or vasodilation. And also in parasympathetic, for decreased heart rate, constriction of pupil, increase GI mortality on that time. So next is to be sweat gland. So the cholinergic system, sympathetic postganglionic nerve ending supplying the sweat gland. So it increase the perspiration during the overheating, so releasing the sweating for reduce the body temperature during the overheating in our body. Next is to be skeletal muscle. So what cholinergic system will be doing in skeletal system? Somatic nerve endings supplying the skeletal muscle. So what basically doing in skeletal muscle? There is efferent fibers send the carry the signal into the brain and reached out into the peripherals, and it will be like doing different kind of contraction or movement. It will be occur on the skeletal muscle. It is performed by the acetylcholine is a neurotransmitter. It is a sympathetic cholinergic system will be doing. Next is to be central nervous system. The brain and spinal cord and anterior medulla is to be similar action will be occur into the cholinergic system.